Good evening, I'm Pinky Webb. Tonight we ask the questions, we tackle the issues, we clarify matters, and we get on point. The Philippine Health Insurance Corporation, or PhilHealth, was designated by law to be the country's primary health care insurer. But with its unused funds growing to hundreds of billions of pesos, government gave it zero subsidy. With universal health care still a distant objective, many criticized PhilHealth for not using its untapped funds to improve its services to the people. Some say the agency was mismanaged and are calling for a shakedown. Let's get on point with Health Secretary Ted Herbosa. Secretary Ted, good to finally see you again. Welcome to the Billionario News Channel. Thank you for your time, sir.
Thank you very much, Pinky, and thank you for having me here in Billionario, my very first live studio appearance.
I'm happy you're here. There's lots to discuss. I'm going to start. We'll try to make this quick because there's so many other things to talk about aside from PhilHealth, but I'll start with this. Let's explain this in numbers because it's official. Zero subsidy for PhilHealth. That means yung subsidiya para dun sa mga indirect contributors ay hindi binigyan ng pera ng gobyerno.
Correct.
That's right, sir. No? But their numbers, because they're saying that PhilHealth is financially stable. Ito po yung numbers na lumalabas from the different research I've seen. 280 billion in reserve funds, 150 billion surplus, 400 billion in investments. I think this was coming from Secretary Recto. Can you please explain, ano ho ba yung reserve, ano yung surplus, and investments?
Okay, so the reserve is money that is required by law to have 2 years of operations of PhilHealth. So it's about 280, right? 280. It's about 100 plus every year. It's what PhilHealth spends to pay health benefits of members to hospitals and doctors, and also to operate the whole corporation. So the law required that it should be viable for 2 years, and it's used for emergencies like COVID, or if there is a big pandemic or something, at least we can still shoulder the cost. The other one is called the invested funds. So the reserve is for the 2-year reserve. The other one is invested funds. It's over 450 billion. And it started with about, when the law was revised, PhilHealth was first created in 1995. Initially, you couldn't invest the money. You just have to use it when after people get hospitalized. But in a later iteration, I think 2013, they already modified it and allowed it to invest 5% of whatever they are able to save. So that investment grew from 150 billion. Today, it's about 500 plus. Actually, kinuha yung 89.9 back for, that's the famous 89.9 national return. So that's called the invested funds. So they invest that in, in holdings and everything, and it's like put in the bank.
So may pera na more or less 400 to 500 billion. Okay.
Plus 250, so it's about 600. Plus the last year's surplus. That means yung hindi na ibayad from the contributions is about 150 billion.
Hindi nagamit, you mean, hindi nabayad. Okay, so it's clear now. Yung 280 billion, kinakailangan yon for its existence, for its
2-year existence.
Tama, para po mabayaran ko anong kailangan bayaran. Yung investments, 5% of their money can be invested. This has ballooned to 500 billion pesos.
Correct.
Okay.
Correct.
Pero may surplus pa. Sir, bakit po nagka-surplus ng 150 billion?
So when not so many people utilize the investments, and number two, the support value of PhilHealth is only about 14% of the total healthcare cost. This is the other equation. The other equation is that PhilHealth needs to increase. That's why you're hearing announcements. The board has been increasing all the benefits of PhilHealth, 50% increase after an initial 30% of all 9,000 case rates. And then we're creating packages for heart attack, for rare children's disease. So we're trying to get people to universal health coverage. So that's what's important. What's important is PhilHealth is able to pay the health benefits of its members rather than putting it in the bank. If it was a pension fund, they're doing the correct thing. If it were a pension fund wherein later on you have to pay the pension of elderly retirees, that's correct. But you see, health insurance is a short-term insurance. You pull your money together, and then only 10% of the population gets sick. That money that we pulled together is going to be used to pay for the health benefits of the members. So part of the members, there are two kinds of members, the direct and indirect. Direct are employees or people who are working like you, who contribute from out of their pocket. Half comes from your
5%.
salary, and another half comes from the employer. Oh, so that money is untouched. And then there is the subsidy for the indigent, the senior citizens, persons with disabilities, which the law created. And every year, PhilHealth requests for subsidy for that. That's the one that was put as zero.
Okay, so malinaw po yun. Ang hindi binigyan ng budget, kaya nga zero subsidy, ay yung mga contribution ng gobyerno para sa mga indirect.
Correct.
How many are they, sir? 5 million ata?
Parang
More or
5
less,
million,
no?
more or
Okay.
less.
Here's my question. Isn't it unfair that government says, ang dami naman pera ng PhilHealth, so hindi kami magbibigay ng pera dun sa indirect, pero kayong mga direct contributors, magbayad pa rin kayo?
Hindi. It's not gonna come from the direct. What happens is, ang sinabi sa batas ng PhilHealth, what is said in the law is that if there is excess money, that means their savings grew, they can either increase benefits or lower premium payments. So this is one way of making them pay for the premium of what they ask for from government, from the subsidy of our tax. In fact, that relieves taxpayers. That means our tax can be put and used in education.
Yeah, but that doesn't relieve
PWS.
taxpayers.
Yeah.
It moves our money from one place to another.
Correct, correct.
Okay, so I'm going to ask you again, sir, because from my understanding, government pays for the
Premium.
indirect, we pay, tayo po nagbabayad, tayo yung direct. Dalawa lang naman po, direct and indirect. Sabi ng gobyerno, hindi namin babayaran yung indirect kasi ang dami yung pera eh. Pero kayong direct, magbayad pa rin kayo. Isn't that unfair?
No,
Because it could have easily been...
That's not unfair. That's the concept of health insurance. It's called solidarity. So that the people that pay are probably healthy. They're probably the ones that have good nutrition. And the people that are poor are the ones we are supporting. So it's really the concept of universal health care, wherein everybody puts in money, but we support those that need healthcare most. So it's usually the poorest. Kasi sila yung pag na-hospital, walang pambayad eh.
Right.
The people who have salaries or who have income can even go abroad and get best healthcare, right? So that's the unfair. That's the inequity we're trying to solve with PhilHealth.
Kasi parang sila subsidized,
Correct.
di ba, Sector? Pero pwede rin ho ba, could it have also been an option because PhilHealth has so much money that they will say, everybody, no premium for 1 year, dalang daming pera ng PhilHealth, then that makes, it relieves us as well.
That's a nice idea. That's a nice idea because as you very well know, early part of last year, I actually opposed the increase in the premium payment, which was actually part of the UHC law. So I actually opposed that. We had an argument with the president who wanted to continue it because of the law. I was hoping the president would continue. Tinuloy naman yun because that's the last. Wala nang increase.
Part of the UHC, yeah.
And then our senators put in a bill, modification, na hindi na dapat ila-legislate yung increases and decreases of premium, but it will be decided by the board. So which is also, I think, the right way to go. So, we're all learning how to run our health insurance.
All right.
But the key is, it's still low in support value. I'm looking at about 50% to 70% of healthcare costs being paid for by PhilHealth. Imagine, if you get hospitalized, at least PhilHealth will pay for 50 to 70%. Andun lang sa 50, but we're only at 14.
Meron po akong follow-up dyan. You said it a while ago, so I'm gonna underscore that. You said 14%. Basically, PhilHealth pays more or less 14% pag na-hospital ka.
Correct.
Napakaliit nun, Sec Ted. So sabi niyo po, gusto niyo sana 50%. And under the UHC law, on this year, dapat po, hindi na yan 14%.
Correct.
Eh.
Correct.
So dapat mataas na po siya.
Kasi we passed the UHC law in 2019. But 2020 came COVID-19. So we had a pandemic for 3 years. It was basically unimplemented. All our money was put on COVID and all the health facilities and quarantine facilities. So I'm now catching up, trying to get to the 10-year end of the that's going to be at the end of the term of the president, 2028. Dapat we should have attained universal health coverage. What I can say is we have universal health coverage because everybody is covered. But the support value is what's low.
Very low.
The nice thing is the poor already get actually free health care. If you go to a government hospital, they go what's called no balance billing. That means the income of the government and the subsidy to the government hospital, the salary of the doc pays for your healthcare. My problem is now kayo, the middle income and the high income, who actually contributes. So when they go to a private hospital, it's only 14%, even as low as 12% pag catastrophic illness. So your bill can be like 100,000 and 14,000 lang ang babayad ng PhilHealth. Ganun man, pag nakita mo yung mga bills ng relatives or friends mo, ganun yung amount. So we're now increasing this. So the board, through the benefits committee, which I chair the benefits. We have been studying all our packages.
So you chair the benefits committee?
Yes.
Okay, good. All right,
so
perfect. You're the perfect person to talk to. So let's give them a brief background, sir. Now, what happened? Please correct me if I'm wrong. This benefit package was not increased for 10 to 12 years. Okay? Nag-increase lang po siya itong 2024 February last year.
30% increase.
30%. But for 10 to, is it 10 or 12 years, Ted?
10 years.
Okay, 10 years. Sige, lagay po
12
natin
yata,
sa 10.
kasi the case rates were done when I was undersecretary. The case rate of the 9,000 case rates were developed at that time. So, since
what year was that?
2012, 2013.
Okay.
So
let's
now
put
it's
it
2024.
Let's put it at 11 years.
11
Ganun na
years.
lang. Okay. For 11 years, hindi po tumaas ang case rate. Tama ho?
Tama.
In spite of inflation, in spite of all that, what happened at 11 years, that case rate stayed the same. For example, pneumonia was at, let's say, kunwari lang po, 2,000 back then. 12 years later, it was still at 2,000 up until February of 2024 na in-increase po yan ng 30%. Sir, here's my question. Bakit po hindi nagkaroon ng increase ng case rate in 10 to 12 years?
Alam mo yan ang hindi ko masasagot kasi wala pa ako sa PhilHealth. But I'll tell you, the 30% increase in early part of 2024 is just the inflationary increase.
Right.
It's not a true increase.
Exactly.
It's a corrective increase of what the previous administration's management of PhilHealth has not done. So we tried to correct it with the 30% cost of money. But the second one, itong 50%. Recently in-approved natin starting January 1, the 50%. Ito na yung totoong increase ng benefit.
So
pero maliit pa rin,
paano lumalabas? In 12 years, nag-increase lang ng 50% in 12 years. Kasi parang yung 30% inflationary lang po yun.
Ba ang 30%? So like say, if the benefit package is 10,000, in-increase mo ng 30%, naging 13,000. Pag in-increase ko pa siya ng 50%, plus 7, naging 20,000.
Yeah,
tama.
plus 7,000.
Kung ang bill mo 100,000, it's still
20%.
It's still 20% of your bill. I'm still not at my dream of getting 50%.
But is there anybody to blame for that 10 to 12 years na hindi po nag-increase? Kasi sasabihin na lang po ba natin na ay pasensyahan na lang tayo kasi hindi sila nag-increase ng 10 to 12 years. Tapos tayo po ay bayad ng bayad. Is that fair?
If you look at the history of PhilHealth, it has fired all its board members. It has changed its president in 11 years. In 11 years, it had 10 presidents.
Yeah.
So, what can you do? Every time there's a new president every year, parang. So right now, we're actually able to move because of the UHC, where I'm playing catch up. I'm really playing catch up and making sure that we have universal health coverage. What I can be proud of is, together with a fund in our Department of Health, we have the Medical Assistance for Indigent and Financially Incapacitated Patients, MAIP. Nagagawa namin yung pag poor ka at nasa hospital ka, zero na ang babayaran mo.
Okay.
So, but that's for the poorest. So the poorest have universal health coverage. They can go to heart center, get an angioplasty, and the government will pay for everything. But itong si working class na Juan de la Cruz, pagpunta niya, may bayad, may co-pay siya. This is called the co-pay. So you still pays out of pocket, even if it's a contributor. Pero si indigent, di nag-contribute, national government.
Which we're happy about, no? Second, obviously. Pero, pag yung working class po, tamaan ng sakit na...
Catastrophic.
Oo, mahirap po para sa atin yun.
Magkakautang-utang siya.
Dahil wala pong savings. And if PhilHealth only pays 14% average of the total health, cost of the hospitalization, that's almost close to nothing, really.
Yeah. So there are two options for the working class. Either go to the government hospital, which we have also modernized because of sin taxes, napaganda na naman namin yung mga DOH hospitals. So, ang problema, ang daming tao,
Yun
pila.
na nga po.
So, if you have a child and you're sick, sabi mo, ay, hindi ko napipila anak ko dito. I can afford to pay. So, I'll go to a private hospital.
Yeah.
Then, they get shocked they get bill shock when they're going home. Kasi nga, malaki pala yung
Paano
bill.
yun? How can you balance that out? You've been there for so long. So government hospitals are too full. Actually, even kahit private hospitals, punong-puno na rin
Puno
po
na rin,
ngayon.
tama siya.
Paano ho niya kaya mababalance yun para hindi po para somehow ma-distribute po yung mga pasyente and their needs?
So that's where our strategy is to go towards primary care. So prevention, nutrition, health promotion, wellness. So get people healthier, prevent them from getting to the hospital. So if I give good nutrition advice, making sure everybody eats balanced diets, pinggang Pinoy, plenty of vegetables, fruits, and less carbs, they will get less sick. I look at number one, yung unang binabayaran natin, yung dialysis. Dialysis in the Philippines is 70 to 80% is caused by diabetic nephropathy. That's the end stage of diabetes that's not controlled. But if I prevent people from getting diabetes with good diet, exercise,
Hindi ka naaabot dun.
hindi tayo aabot dun sa dialysis. So that's I'm shifting the lever to go towards nutrition, wellness, prevention, keeping the population healthy. That's what other countries have done. You've seen the blue zone.
Yeah, of course. Yeah.
Costa Rica is not a rich country.
Meron nga
but
bagong blue zone. I think Singapore is now part
it's
of
now
the blue
in
zone.
our area is now blue
I'm
zone.
happy you said that too, because when you talk about prevention, there is there is a provision in the UHC law that talks about the Consulta Package. We're going to talk about that after the break. Our discussion with Health Secretary Ted Herbosa. After the break, please stay tuned. This is On Point.
Nuestro Padre Jesús Nazareno, niluluwalhati ka namin. Nuestro Padre Jesús Nazareno, dinarangal ka namin. Nuestro Padre Jesús Nazareno, dinarangal ka namin. Nuestro Padre Jesús Nazareno, niluluwalhati ka namin.
Welcome back. You're watching On Point. Still with us, DOH Secretary Ted Herbosa. Sabi ko, marami pa tayong pag-uusapan. Consulta Package. I need to bring this up, Secretary. Sabihin ko na rin po because I posted this on my social media account with Dr. Mingita Pagdilla back then. She told us about this Consulta Package. Sir, so many people reacted to it. Please help us understand. Meron ho ba talagang Consulta Package na merong screening na magkano ho ba ang pwede naming ma-avail?
Okay, so for the Consulta benefit package, the benefit package is 1,700 pesos per year per individual. So the individual in the UHC law are free to choose whether they go to the public sector or the private sector. That means if you go to the private, may additional copay. But if you go to the public, the local government will take care of the test. It will cover some tests and some medicines. But it assumes, it's called risk pooling, Pinky. So you have, let's say, 20,000 individuals per doctor. And then they will give a certain tranche of the 1,700 per individual. And that's supposed to be used by the local government to provide free blood test, urinalysis, ECG, maybe X-ray and ultrasound.
Are we entitled to it? Is everyone entitled to this Consulta Package?
The
I'm
problem,
sorry if I didn't understand
everyone
it.
is entitled as long as they're a member. The problem is
But everyone is a member.
the health facilities that are accredited as Consulta are still a few thousand. If I'm not mistaken, around 2,000 pa lang. So it's moving very
accredits
slowly. PhilHealth, because you have to have certain approvals to be able to be a Consulta provider.
Like a clinic, ganun ho ba?
There
Tama
have
ba?
to be a clinic with
Okay.
doctors, and then there is what's called the first patient encounter, when all your data is taken, and then so benefit yon. So if you have a population, may mga bata may mga matatanda, may sakit. Yung matatanda, i-check up mo. Yung mga bata, after initial check up, oh, you're okay, you're good. We don't need any test for you. You're healthy. So that's the type of prevention. Also, for me, that was developed before I came in. And I'm not so happy with it because exactly what the question is after it's been explained to people, how do they get it?
They don't know, sir.
Exactly. Not only do they not know, it's very hard. And now I'm seeing parang may mga problem kasi someone said, I'm registered in Liliw, Laguna, but I live in Pagsangan. How did that happen? So parang what's happening is there's also some level of problematic implementation because people just put lists of people. So it's not the true primary care. My idea of good primary care is you are entitled to, let's say, I give you a certain amount of money. If you go to a clinic, I want a checkup. This is what we'll pay for. Parang hospitalization.
Parang meron kang credit
Oo,
na
yung-
1,700, pumili ka na kung saan mo gusto
gusto
pumunta.
magpa-CBC, yan, ubusin mo yan. Pero yung sobra dyan, babayaran mo na out of your
Oo,
pocket.
of
Tapos
course.
kung poor ka, doon ka sa public.
Government,
Sa
yeah,
public,
yeah.
then ililibre na nila yung...
Can't we do that? And how much is allotted? Because there was talk with, if I'm not mistaken,
I-increase pa uli namin yan to 2,3 yata.
3,000.
To almost, basta iadagdag namin yung gamot eh. Yung gamot package. So there's the Consulta Package, which is really the tests, some of the tests, and the gamot package, which is planned to actually pay for chronic meds, antihypertensive,
So let me go
asthma.
back to my question, sir. How can we avail of this?
You have to register in a Consulta accredited health center. So you have to ask your local
LGU.
LGU if the health center is Consulta accredited. Usually may sign naman yan eh. PhilHealth accredited.
Okay.
And then
Kasi
they will give first patient encounter. You'll be
Can't
put in the
PhilHealth
room.
fix its website, sir? Because some of the comments I was getting was that pag punta sa website, page cannot be found or something like that. I mean,
Because it's still what they call a sandbox or an experiment. So it's like beta test. They tested this because remember, PhilHealth was designed as a catastrophic illness insurance for hospitalization. It's only the UHC law of 2019 that forced it to do primary care. And this is where the difficulty is because primary care can be population health and that's DOH. So in the UHC law, technical to, no? There are two types of healthcare. There's population-based healthcare and individual-based healthcare. Individual-based healthcare is what PhilHealth should pay for. Pag na-hospital ka, babayaran niya. And population-based immunization, nutrition, maternal
DOH
care
yan.
is the Department of Health. Now, the problem is naghalo siya dun sa ginawa nila because the people that formulated Consulta Package came from the DOH. And so to me, sabi ko, parang hindi yan tama. So, I cannot change it naman while it's
Maayos
running.
ba ito?
Well, naayos na
You're
namin
the chairman
some
of the board, right? Of
Yes.
PhilHealth, okay.
And also the benefits committee. So we need to evaluate the initial implementation of Consulta. The fact that ang daming hindi alam at hindi pa nakarehistro after 2019, 6 years since the UHC law, may problema tayo dyan.
Yeah. May problema ho ba sa presidente ng PhilHealth, sir?
Well, the president is not health-oriented. He's from the banking industry. So I need someone that can run PhilHealth with the knowledge of how health economics. You know, kasi ibang-iba ang health economics sa banking and finance. And many people are putting people with banking or finance expert in PhilHealth.
Investment.
But they miss out on what happens in health insurance. Let me explain about health economics. It's something like this. If a person gets sick, they don't care about the cost. If your mother gets sick, your father gets sick, your loved one gets sick, you will pay for everything. Pautang benta mo, bahay, kalabaw, whatever, basta gumaling yung loved one mo. But when you buy a house or a car, you only buy the house or the car that you can afford with the money in your bank, but not with health. So it doesn't follow the regular economic supply and demand. You will always demand. The demand for healthcare is always, that's life. You don't get the healthcare, you die. Diba? So people will, lose money, sell their livelihood. So ito yung what we're trying to change with universal healthcare. We're trying to make equity. And this is where the solidarity comes in. So people with money would contribute to a pot, and the pot is parang paluwagan.
Apo.
Very similar to a car insurance. You pay your car insurance every year. Pag hindi ka nabangga, hindi ka na-damage,
Forfeit.
wala na yun. Ano na yun. That's part of a pool of money
Okay.
that you use to, pag naman ikaw na-damage, may babayaran yung insurance pag repair ng car mo.
Do you see a problem with the present PhilHealth president, Mr. Ledesma? Should he be changed? Because you're saying that kailangan po ng health economist eh.
The whole management of PhilHealth has to be changed. There are a lot of reforms that need to happen in PhilHealth. Not only, we've tried that. We've changed presidents every year.
So the whole
for
management,
past.
sir?
I think there are system changes that needs to be done.
Sino pa ho ba yung sa structure nila?
So
may
there's the
presidente,
chief
president and
operator,
CEO.
President
hindi ba?
CEO, there's the executive vice president and COO, chief operator. There's vice presidents for financial management. There are regional vice
So you're
presidents.
saying all of them should be changed?
There's digitalization that needs to happen.
Yeah.
You know, so in this day and age when you get your cell phone, you get your bill, you don't pay. You know, they cut your service. But here I have hospitals and doctors complaining, hindi pa kami bayad, 6 na buwan na. So parang that's unheard of in the era of digitalization.
But to be fair, sir, this is not something that just came out now. Yung hindi po pagbayad sa mga ospital, ang tagal na, every year, in the past year, na pag-uusapan ho yan eh. So, basically you're saying there's a problem with management until now.
So that's part of why the budget was zero. It's called fiscal discipline. You've heard some of the people saying, we're trying to make PhilHealth use its money. So that's called fiscal discipline.
Teaching,
Kung ikaw may pera, nag-ipon ka, tapos, mami, pahingi pang baon. Yung mom said, binigyan na kitang pera last year, di ba? Gamitin mo yun, di ba?
Okay.
Parang, so it's something like that. Parang use that money first, and then, ang PhilHealth law has sovereign guarantee. So yung mga taong nagsasabing malulugi ang PhilHealth, actually, there's a provision, Section 84, I think. It says, the state will provide. We will just ask extra money. During COVID, what did we do?
Yeah.
We created the Bayanihan Fund to pay for COVID illness. Tapos,
May pera doon, in other words. Even the president said that, right?
And at that time, kumita ang PhilHealth. Kasi walang nagpa-hospital.
Yeah.
Only the people with COVID. Takot ang tao pumunta sa
Right.
hospital.
Okay.
And at that time, PhilHealth was the only corporation probably that earned a lot of money.
So, just going back to that, so the whole management team needs to be changed, you're saying?
The system, I think the PhilHealth system needs a big boost of revamp.
Yeah. The system is the president, CEO,
yeah,
COO, yan po,
management,
kailangan
man-
pong, okay.
And then the other one is really using digital technology to really pay, like our cell phones, connection to the internet. It should be that efficient so that hospitals don't wait. Hospitals are losing trust in PhilHealth because some hospitals are closing. You know, this, what they call the mom and pop hospitals. If our mom and pop hospital, there's a doctor or a couple in the province, they realize there's no hospital in their area, they earn some money as practicing doctors, they build a hospital. Nung una, it's out of pocket, it's cash. So napapatakbo nila. Minana na ngayon nung anak, ang daming regulation ng DOH, hindi sila binabayar ng PhilHealth. Wala silang credit line sa bangko. Binibenta na lang nila. They just sell the hospital.
Alright.
That's not good because we end up with less hospitals.
Okay.
PhilHealth should be doing the opposite. Investing on hospitals and making hospitals grow.
And also because there was so much money, the question still remains, bakit hindi niyo na lang tinaasan yung packages, I mean PhilHealth, ang dami niyo naman palang pera. Kung ang sinasabi po natin, ang out-of-pocket ng PhilHealth, ang binabayaran ng PhilHealth, 14%, technically, we pay, how much is that? 86%.
86% of your healthcare costs.
Ang dami palang pera eh.
And we're one of the most expensive
it's illogical
healthcare,
to me,
correct.
yeah.
In fact,
So-
that was my first question. When I became chair of the board, when they showed me these reserve funds and the invested funds, when are we going to touch this? No one answered me. There was no answer. So luckily now, we're going to use it. So
Okay,
we approved
alright.
a 248 billion peso
yeah.
budget for 2025. That's going to come from there.
Okay. We're going to do a rundown of other things. Sir, just the prevention, kasi you said that's really important bago ka pumunta doon sa ospital. I hope that the Consulta Package will be rolled out properly because that can be the start of the screening of people, whether it be 1,700 pesos or that we
2,000.
increase to 3,000 pesos. We need to talk about the problems, these illnesses, HPMO,
Okay.
norovirus, upper respiratory, what's going on, sir?
Okay, so just a few days ago, there were lots of social media posts about outbreaks in northern China. So we tried to verify this. There are really increased cases, but it's not yet an emergency. So we tried to announce it. Even the Chinese embassy here, commended us for saying it's a fake news. People kind of hyped up the number of cases. It's really the flu season in the winter countries. So flu season there. HMPV, when you put in HMPV, oh, that's a new illness. It's an old illness. We're monitoring HMPV in the Philippines. We get about 100 cases of
So we have it
HPV.
here.
We have it here.
Okay.
So it's part of what causes in children respiratory flu-like illness. We monitor what's called ELI, influenza-like illness. So that's under surveillance. So, and some of those are sampled or tested. And those that are tested go into two panels. So panel one, find out, is it SARS-CoV, is it influenza A, influenza B. So they do that test at RITM. And then panel two, test HMPV. Kaya nga, itong data ko, we have HMPV, 94 cases last year, 94 previous year, 23, 2024, 100 plus. So it's an old disease.
Yeah.
So, but it's because
And
people
it didn't really spike, no? From 90 plus to 100.
of about 2,000, 3,000
Tests.
influenza-like illnesses.
I see. Okay.
So it's still about a small percentage, 1 to 7% of total flu-like illnesses.
At saka-
But flu-like illnesses people recover.
Yeah.
If you are young and healthy, with
Minsan
good
matagal lang,
nutrition,
no? Pag tumatanda
3 days,
ka.
5, if you get older, aamin ako, your recovery isn't as good.
Yeah.
And you can get complications, especially the very old and those with comorbidities, with hypertension, diabetes, kidney disease. They're the ones that if you get hit by a flu virus, it can have secondary bacterial infection, and that's the pneumonia, and that's the one that sends you to the hospital.
Yeah.
Or even to die.
Yeah.
Because that complicates everything. Kasi hindi na kaya. That's a second infection on top of a first one.
And when you talk about pneumonia, this was also included in the high
Correct.
grades, but it's moderate risk pneumonia.
Yeah,
which
that's
is
what
number
you
one
have to
claim
be in the
benefit.
hospital. Once you're moderate, if you're mild pneumonia, you can be treated at home.
Opo.
So we monitor two, no? Influenza-like illness and SARI, severe acute respiratory illnesses. So yun yung mga minomonitor ng ating Epidemiology Bureau. That's the equivalent of our CDC, the US CDC or the China CDC.
Okay, but this norovirus,
Also, one of the common viruses that causes rhinovirus, norovirus, these are all respiratory
isn't
diseases.
it diarrhea?
You can have gastrointestinal symptoms. So the advice is, if you're sick, stay at home because you'll just spread it.
Yeah.
Especially, even us in the Philippines, tumataas din to around January, February because we get the cold, what do you call this, north winds or something from, and we have a cool weather from January to February.
Absolutely, yeah.
So,
Okay. Lastly, sir, I wish we had more time, but the first cabinet meeting with the president happened today.
This morning, yes,
This morning.
yes. With
Any
a
marching
full cabinet
orders from
meeting.
the president?
So the
To you.
full cabinet meeting was all about the budget, the 2025 budget. He discussed all the items in the budget that were vetoed, why he vetoed them, and then he wants it to look much like what it was as a president's budget when it
Under
was
the
proposed. Yes, when the National Expenditure Program. Because, so pinapipili sa amin talaga yung mga na-defund, because there are programs that were defunded, hanapin daw namin, and then we will try to look for the sources para we can correct them. So like for example, DSWD's Pantawid Pamilya Program, parang na-cut siya, parang half the year lang. So
50 billion. It was cut by 50 billion.
So we need to look for money that can be put there for the second half of the year. At least as of now, tuloy
Meron
pa yun.
yung
Meron
per
pa.
6 months. Okay.
So mga ganun yung pinagagawa sa amin. So DOH, it's only the zero PhilHealth.
Yeah.
But actually, nadagdagan kami. We're now 253 billion.
Okay.
That's the highest budget ever.
Very
So
good.
in my time that I've been
That's good
in
to hear.
healthcare.
Secretary Ted, we've run out of time. I hope to have a part 2 one time,
Sure.
maybe in a month or so, to talk about what can we expect from the DOH in the coming months or
That's
for
right.
2025. Secretary Herbosa, pleasure to have you. Maraming salamat po sa
Pleasure.
inyong oras.
I was
Thank
ready
you.
with my programs.
I'm so sorry, sir.
But,
we
we
had
can
to
go
talk
back. We can
about
come back.
PhilHealth.
We
Please
can
come
come
back.
back.
That's On Point. Join us again tomorrow, 7:30 p.m. here on BNC, the Billionario News Channel. I'm Pinky Webb. Thank you for watching.